actually squeeze universities across the country, because NIH is the #1 funder of university research and medical schools and schools of public health. And so this is in certain ways, for all the epidemiologists who told Trump he was wrong, this is his retribution against all these medical and public health scientists who said, vaccines work, we need to, do these precautionary things, wear masks. This is a retribution. And when he squeezes and shuts down these study sections, the domino effect is a lot of these scientists won't get funded for another half a year. The domino effect will be huge. And also, what's not been reported enough is that not only has there been this freeze, but the NIH has politically removed all grant awards for any racial disparities, and of course LGBT disparities as well. So if pages that used to say, we will fund racial disparity research in cancer, heart disease, diabetes, anything mentioning racial disparities have now been deleted by the Trump administration. So it's during this phase, they're actually politically purging all NIH research that is not in their favor, not in their political, Project 2025 ethos, and of course, exact this retribution against all the public health and medical scientists who, he has vendetta against from the pandemic.
As the only person I think who's worked in the dirty business of politics, I would say nothing would be more popular than curing a disease, any disease. I mean, what? Yeah, I mean, what is the long-term consequence, and how does, if Trump wanted to put all this back together, how long would that take?
Well, to rebuild something after you burn it down takes a very long time. But right now, I think after the squeeze over, they say, well, it's a temporary pause. I've heard this, it's a temporary pause until February 1st. But the issue is these meetings, these in-person meetings actually will be probably rescheduled 2, 3, 4 months from now. And the impact of that research is, we're talking about medical research, clinical trials that cannot pause, but they're scattered around the US, around the world, trying to find cures for all these diseases, find cures and vaccines and treatments for these neglected diseases. So the impact on universities will be humongous. Entire university budgets might be frozen for quite a long period of time. But greater than the silence on scientists and other researchers speaking out. For example, CDC not publishing the MMWR report that Dr. Tom Frieden mentioned, first time in 60 years. It's devastating because now also, even if they restart it, there will be this eerie silence, this unspoken, you better not publish anything that we don't want you to publish, which again, during the pandemic, we know the Trump administration muzzled MMWR scientific reports on the pandemic, or anything that he doesn't like. So they will have a huge chilling effect. And of course, the systematic deletion of all racial disparity research on NIH website, that will devastate a huge numbers of people. I know a scientist at a major university says, they worked so long for one of these racial disparity researches. I don't think they're going to get funded anymore, considering the whole grant award program got shut down overnight. And that has not been talked about at all.
It is stunningly abrupt. I mean, Alex, we spent a lot of time on Project 2025 on this program. In the dog days of summer, we would just flip open to any page and read from it. And this feels like someone decided to go further than even what was put on paper, including attacking cancer research. Let me read some of the reporting in Forbes. These grant review panels, where a team of NIH experts review research proposals, are required before the $47.4 billion agency will disperse money to support research by hospitals, universities, and biotech companies. The biggest chunk of this money goes toward cancer research. The NIH budget has a $7.1 billion annual budget for the National Cancer Institute, of which more than $3 billion a year is allocated directly towards research for the diagnosis, prevention, and treatment of cancer, which causes more than 600,000 deaths in the U.S. every year. The rest goes to patient care, training, and disseminating information related to the disease. This would seem to me to be supported by 0% of Americans. What is the, I hate to even posit this, but if common sense prevailed and this were turned back on today, I imagine some of this work is still impacted. Is that the case as far as you understand it?
Yeah, and again, I think it's, as Eric said, that there will be delays in rescheduling meetings and getting grants dispersed. And a lot of these things are very sensitive to deadlines and timing. So if there's a gap in funding, that could end up closing down a lab or halting equipment or halting experiments, which would then have to be restarted, which is more expensive. So it's a waste of money from that sense, even to delay for a few days. It can also threaten people's salaries and livelihoods. And from a business perspective, a lot of small biotech companies, which are kind of the engines of research for pharmaceutical companies, often depend on NIH grants, working with NCI on clinical trials and things of that nature. And that's expected to continue because right now interest rates are high. They're expected to stay high. When interest rates are high, investment in biotech tends to go down because it's a riskier long-term investment. And so government funding becomes all that more important.
And if anyone had any doubt that retribution is on Trump's mind when it comes to the titans of America's public health agencies, Dr. Anderson, this news also broke this week that in the New York Times that Dr. Fauci was stripped of government security protection. Fox News actually reported this year that the U.S. Marshals said that Fauci had received, quote, countless death threats. A man was sentenced to 3 years in prison in 2022 for sending Dr. Fauci and other health officials a long series of threats. So someone that even Fox News has reported to be under threat, death threat, is someone that Donald Trump singled out and targeted to be stripped of government security. Your thoughts on the impact that has on public health leaders?
Chilling, to say the very least. And there's always debate in healthcare, and healthy debate is a good thing. But to withdraw protection from someone that has devoted his life to saving American lives, to advancing research, to taking data and making it into action, it sends a chilling effect. Why would you step forward and be a champion for public health if this is how you were treated? I think we stand on the shoulders of giants in science and in healthcare. But to think of these kind of threats against them is really incomprehensible. And I think to your notion of how long it's going to take to recover from this, I really don't know how long it's going to take.
Yale Daily News reports this: we'll lose a generation of scientists. They go on to say 53% of grants received to fund research at the Yale School of Public Health came from the NIH, and the Yale School of Medicine is ranked 4th in the nation for total NIH funding. Quote, I'm just worried that this trend continues, that we'll lose a whole generation of scientists. Eric, what is the hope, I guess, for resistance, for a sector of public health that is so interconnected with federal research and federal dollars?
Yeah, as I was saying, like, scientists are critically dependent on NIH. It is literally the bread and butter of most universities. And to cut that off is, again, part of Trump's retribution against the woke academia, I guess, and against scientists who already told him how he endangered lives during the pandemic. I think in going forward, even if the funding is lifted, many scientists won't be able to, get their career advancing. But more publicly, I think scientists know that, they can't. I think scientists are going to wake up after this moment and realize they can't just sit back and just hopefully, put out their hands, please, sir, can I have more, in terms of begging and praying for funding. I think what they have to realize is, science, you can't just pee in the wind. Hopefully a policymaker will use the research. They actually have to fight back. And scientists have to speak up, not be afraid of the political winds, because, some people say don't politicize public health, but public health is policy, policy is politics. And science right now is funding, and funding is politics now. So this has gotten very real, and I think a lot of scientists are going to wake up, and I think the scientific community can't stand back while misinformation, disinformation, and the muzzling of science is ongoing. I think this second Trump administration is truly the time when scientists will hopefully stand up and realize that they can't just rely on doing the science. They have to be public advocates and fighting for medical research.
I mean, the other half of it are the patients who benefit from scientific research and advances. And it's a conversation that has to happen. We're going to need all of you to have it. Dr. Eric Feigelding, Dr. Michael Anderson, and Alex Knapp, to be continued. Thank you for starting us off today. We'll bring our political panel into this conversation after a short break. Also ahead for us, the deportation raids have begun, what we know and what could be coming next, in another example of the cruelty being the whole point of the second Trump presidency. And later, it's only the first week, we'll talk about something that's on everyone's mind these days. How are we going to do this? How are we going to get through another 4 years of this? Our friend Dan Harris will be our guest later in the hour with the answer. Deadline White House continues after a quick break. Don't go anywhere.
Home is where we do the things we love with the people we love. Celebrating, sharing, living. So why should aging mean we have to leave that in the past? What if we lived tomorrow in the same place as we did yesterday? What if we stayed home instead?